Good afternoon. How is everyone? We're having a few little technical glitches today, so just bear with us. My name is Laura Spradley, and we are so glad you're tuning in today to learn about this great topic. We've got some great speakers. We're going to talk about telehealth and teleeducation, and obviously it's a hot topic right now due to the pandemic and everybody having to figure out how to get to the doctor but not go to the doctor. So we're here today to learn about telehealth. My name is Laura Spradley. I'm the outreach coordinator with the Arkansas Geriatric Education Collaborative, and we are collaborating with Alzheimer's Arkansas, one of our best buddies, on collaborating together on events. And we have included AR Cares today. And I've got Alan Faulkner with me, and he is the let's see, I want to sure I get it right, Alan, Vice President for Virtual Care. So they've been doing this for a long time. So we are so anxious to be able to talk to Alan. And he's also got with him Ashley Bagwell, who is an APRN with AR Care. And they have both been doing telehealth and teleeducation for a long time. And so I hope that y'all have your questions ready. And we're going to start off with just a few little housekeeping notes. Send us your questions via Facebook, and we'll get to you as soon as we can. If we can't get to all the questions, we will get to you after the show. So if we didn't get to you during the show, we'll get to you afterwards. And just a reminder, and it's going across the bottom of the screen as well, but this is not a place to ask healthcare questions or to ask questions about coronavirus, anything like that. This is just an educational conversation that we're having today about telehealth. So thanks again for tuning in. I thought it would be important that we kind of go through some history of telehealth, and I have a little history lesson for you before we start, so bear with me. Do you know that in 1876, Alexander Graham Bell invented the telephone, and that's where it all started? I had no idea myself that that's where all this would start. So it's been great for me to learn about it. And then in 1959, two hospitals in Nebraska decided that they couldn't talk to each other because they were 122 miles apart, and so they did a teleconference. And then in the 1960s and 70s, who got involved but NASA, because they wanted to take care of their astronauts up in space. So they really took telehealth to a new level up there in space. And so it's been exciting to learn about telehealth, the little bit background I did before this presentation. And I want to know if anybody else knows this, but in 1964, AT&T launched the first picture phone. So picture phones have been along since 64. So I'm going to turn it over to Carolyn due to technical difficulties today, and she's going to start off with the script of questions that we have for Alan and Ashley and for all of y'all to tune in and ask questions. But telehealth has been around for 144 years, whether we knew that or not. And this year they're projecting it to be a $40 billion business, which I'm sure Alan already knew, but it's a huge thing. And it's not, something that all of us are used to. So we're going to learn about it today. So due to technical difficulties, I'm passing it off to Carolyn, and I'm going to sit back and watch.
Okay, thank you, Laura. I really appreciate your introduction and getting us started. So the first thing I'm going to say, if you're watching us, could you give us a like and a share? Of course, we're talking about telehealth, and we are trying to make sure that all of us expand our reach. So if you give us a like and share and so we'll know that you're there, send us a hi, so we can make sure that we keep programs like this going on. So I'm going to start with the first question, and it could be either Alan or Ashley or back and forth, however you guys see fit. Maybe we should start with one of the experts explaining what their definition of telemedicine and telehealth and telecare are. And it seems like they're all different. Are they interchangeable? So just kind of expand on telehealth, telemedicine, and telecare for us.
Okay, I'll take that one, because that was something while I was at UAMS, that was a question that we got asked every day. What's the difference between telehealth and telemedicine? Well, telehealth is the overall umbrella that covers everything. Telemedicine is actual delivery of clinical care via telemedicine. And then telecare, that's kind of a gray area, but most of us refer to that today as remote patient monitoring. So that is virtual care through devices that are located in the patient's home.
Okay.
So that's kind of the three ways that we break it out. Whereas it all falls under telehealth, not everything is telemedicine. So if that makes things even more fuzzy for everybody.
Okay. So tell the audience who is utilizing telehealth and teleeducation, and especially for those in the older populations, what kind of specialties, physicians, like who can they expect to want them to utilize telehealth, teleeducation?
Well, since the COVID pandemic, it has really telehealth, telemedicine, teleeducation has really it's just exploded everywhere. Prior to the pandemic, though, we had our providers, we had doctors, DOs, doctors, APRNs, physician assistants, registered dietitians, pharmacy, were all utilizing telemedicine to reach areas in the rural populations in Arkansas with our care. Ashley has been a telemedicine provider now for how many years, Ashley? You've been doing this for?
We're on and off for about 3 years. Yeah.
But telemedicine has been around for quite a while. ArtCare really jumped into the telemedicine field about a little over a year and a half ago, and it has just grown leaps and bounds since then. But like right now, we're doing behavioral health. We're doing DSME. Medical nutrition therapy, intensive behavior therapy, chronic care management, acute care, pharmacy. We're doing correctional telemedicine, which is another area that's growing pretty rapidly. So there's lots of different things. And when the pandemic hit, we found that a lot of people were afraid to come to clinic for fear of being exposed. So then when the rules were relaxed, we started doing just primary care visits to the home. And we found that a lot of our patients really enjoyed it, and we're hoping that it'll stick around for a while.
Okay, that kind of leads me into my next question: is when you utilize, how can patients expect for us to? And Ashley, you can answer it, to be used. Like, is it for new illnesses, annual physicals, follow-up visits? Like, how can they expect for the healthcare provider to request them to use telemedicine?
Telemedicine can actually be utilized for lots of different things. The biggest thing that we can't do is our hands-on stuff. Like if you're actually getting a physical, like a physical for DOT, your physicals for sports, anything like that, you have to have hands-on. Your well baby visits, they are hands-on. They actually have to be done in clinic. There's other things out there too, like belly pain. There's lots of folks that we see with belly pain over telehealth, and that's something that you really need to have hands-on with. Chest pain is another thing that needs to really be hands-on with, because you need to do EKGs. You actually need to listen to find out what's going on with them. But anything else, if you got a runny nose, if you got allergies, if your ear hurts, anything like that, chronic care management can be done all through telehealth.
So getting back to, and I know this becomes important to most of us, is this something that Medicare, Medicaid, or insurance, do they all pay for them?
Far as we have not had anybody to deny any payment for telehealth yet. Arkansas, of course, they regulate our Medicaid, but so far so good. Everything has gone through fine, especially with this COVID pandemic going on. Mm-hmm. Our Medicare, that's nationwide. So Medicare has actually approved annual wellness visits for our Medicare patients, where we can do that through telehealth too. Okay. Through Medicare, they say that you don't have to have a hands-on, that you can schedule labs later on if you need labs, but actually doing a wellness visit, you don't have to have hands-on. So that can be done through telehealth.
And to expand on that a little bit, Carolyn, too, Arkansas is a parity state. And basically what that means is that for telemedicine, if it is comparable to an in-person visit, the law states that the pay sources must pay for it. Okay. As an FQHC, or a federally qualified health center group, our rules have traditionally been different, where we're not allowed to provide to the home service via telemedicine, but for all the other types of clinics out there, they can. Now, with the pandemic, they've ease those restrictions, and we've been doing a lot of stuff, a lot of telemedicine to the home. But for the most part, we haven't had any issues with that. Our biggest issue has been connectivity for the patients at home.
And that kind of brings me to my next question about connectivity. So I understand that, we are a world of cell phones and internet and broadband. So is Arkansas ready for that? And on the part of that is, if they don't have internet access, is telephone just as good? Do you use telephone visits as well, just like using your cell?
We've done both, and that during the pandemic, of course, we do have, believe it or not, there are still people that, one, they don't have an email address, they don't have a smartphone, and there's more of those people out there than you think.
I know.
So we did some plain old telephone consults. We've done several of those, but I was really surprised when we first started doing to the home when COVID hit. Believe it or not, most everyone did really well with their smartphones. We were connecting over video to their smartphones. Now, the cell service, if it was pretty low, if you had less than 3 bars of service, it would break up and be a little choppy. But for the most part, it went really well.
Okay, so this is what one reason I was interested in doing this topic is, how do we educate and prepare older adults, anyone that's not familiar? Because anytime we try something new, we kind of get this fear and think we can't do it. So give us some tips on how can we prepare people watching this for either their care as telehealth, and their loved ones that they're caregiving for.
One is know the device. Know what devices you're going to be using. That's probably been about 90% of the technical calls that I've taken over the past few months have been, I have this wonderful device and I don't really know how to use it. Of course, with Apple products, you have to update the software periodically, and with your Android, and you would be amazed at the number of people that just don't update their operating system on their iPhones, and of course that causes issues as well. So one, if you're trying to educate folks that are wanting to do telemed from home, make sure that they've got the most up-to-date software and everything updated on their device. Two, we made a cheat sheet for our providers when they were connecting to folks. It was like a workflow. If you have this device, check this first, step 1, step 2, step 3. And we did that for each different types of devices, whether it was a computer, tablet, Android, or Apple product. So in that workflow, just really it made people more comfortable and more confident that they could actually help their patients get connected. And I know Ashley can probably speak to the number of times she's like, okay, have you tried this? Have you done this? Have you done that? But that's just part of it. The other thing too is make sure you have somebody on hand that can provide that technical support, and be nice about it. Have patience. And when you're dealing with some of the older population, it can be difficult because you just kind of have to hold hands and walk them through it step by step.
And I've actually asked grandparents, do you have a grandchild there? They could probably show you how to do this very easily. So
yeah. And I think the other part is, I've been on the education part of preparing for the visit, is almost like the same steps, like write down the questions that you have beforehand, any symptoms. So I talked to someone the other day, and they're preparing for a telehealth call, and they were just not knowing what to expect. And, I just guided them through, like, write the questions down, be ready, like, this is your time to get in for whatever reason, and make sure you're prepared and know the things that the health provider will need. So I think I'm doing that as well. So we need to be patient, both of us. Because we're all new. Again, like, this is new for most people, except Ashley. It's, even though you've been doing it, it's new to do it so much. So
it changes daily.
Yeah. So being patient is probably the number one thing. So how did telehealth visit work with chronic disease management? And this is kind of like personal kind of for me, because my mom, who has high blood pressure, and it was time for her to get her her follow-up appointment, her annual. And I was just like, how did that work? Because like they don't have your blood pressure to know how the medication is working. So what could we do to prepare more for like those types of visits?
Those type of visits, most everybody that's got high blood pressure or diabetes is going to have a cuff at home, a blood pressure cuff at home. They're going to have their glucometers at home. So you just kind of go over everything, they've had since their last visit. Periodically, you check your blood pressure. What's your blood pressure been running? Have you felt dizzy? Just all the questions you would ask in a normal visit. When it's time for blood work, we can literally go in our system, order the blood work at the nearest R-Care or wherever they want to go, preferably R-Care, because it's a whole lot easier that way because it's just a computer. Send it right over to the clinic. And then we'll call the clinic and say, hey, look, we've got this person coming over for blood draw, and they're probably coming tomorrow. And our patient just shows up, they go get their blood drawn, and they're on their merry little way. We send their medicines just like we normally do to the pharmacy.
Okay. Can you receive your annual Medicare wellness visit via telemedicine?
Yes, ma'am. Absolutely. Medicare approved that back 2 months ago, I think. Might have been a little longer.
I think it was in March.
Okay. So what kind of conditions would you say do not work with the telehealth, telemedicine? And you kind of said it a little bit earlier, like tummy aches and stuff. Could you kind of give us a little bit more information on what does not work and when to seek other provider, sources other than telemedicine?
Chest pain. If you're having chest pain,
Okay.
don't bother about coming to the office. Don't call. Just go straight to the ER. That's one thing that we're going to send you anyway if you're having true chest pain. Talking about the tummy ache type thing, if you're having extreme pain in your belly, if you're running a fever, if you are vomiting uncontrollably, that could be a hot appendix. I mean, that's something that you probably need to go to the ER for. Okay. So that way, or hot gallbladder, you need surgery right away, they're going to take you into surgery type things. Okay. Broken bones. We do not see broken bones over telemedicine. There's no way that we can x-ray. There's no way that we can splint. So,
yeah. Okay.
Just to give you an example, back when this first started with COVID and everybody was terrified to come to clinic, we actually had a provider that had a child, like a 12-year-old, something along the lines of that there had been like sick for 2 or 3 days and vomiting and they dialed up with the provider. And the provider immediately was like, you need to go to Children's immediately. And they're like, well, why? The parent was like, why? What's going on? She says, well, your child is jaundiced. And she's like, really? So that's one of the positive examples of telemedicine. I'm talking about that's something the provider saw it immediately. And she's like, well, look, that his whole upper half is jaundiced and his legs are white. There's something more going on here. So you just bypass me. You need to get to Children's immediately. So, things like that, anything that you can diagnose visually, I guess would be, or if you have a presenter on hand, which that's a whole different bag of chips from what we're discussing today. But anything that you can, diagnose visually would be appropriate for telemed.
Okay.
Does that make sense?
It does. So I'm going to bring this home to my specialty, my field. Is telehealth appropriate for someone with dementia? Would you say it?
Yes, I think it's a wonderful idea for somebody with dementia. You're keeping them in their normal surroundings. You're not taking them out of their normal surroundings. They're comfortable where they're at. It's literally talking over the phone with somebody, with family members there that can redirect, and we can redirect. So I think it's a wonderful thing for somebody with dementia.
Okay. And as you were answering that question, I was thinking about how many caregivers prior to COVID would say to me, I can't get my loved one to go to the doctor because
Right.
they don't want to leave home. Do you see this as maybe being another level of service for people with dementia and Alzheimer's post COVID?
Yes, ma'am, I do. I can remember when my great aunt had dementia, very, very bad. It was a chore. It was an all day thing to get her to the doctor's office and back home because she's not her normal surroundings. She gets very anxious. She gets combative, and a lot of people with dementia do. When they're around their normal surroundings, their blood pressure goes down, their pulse rate goes down. You know, they're completely fine in their home. So I can absolutely see this being a huge thing in the future.
Just, from your point of view, do you find it okay if caregivers request from, moving forward that their loved one with dementia or Alzheimer's be seen telemedicine?
Absolutely. I think it's a wonderful idea.
What about setting the atmosphere? Like when we're talking about people with dementia, is there anything you would say, because sometimes technology and the phone, is there any atmosphere you would recommend personally and professionally for caregivers when they use telemedicine?
Relaxed as possible. Set them down in their favorite chair and have their caregiver or their home health nurse or whomever, to kind of hold the iPad or hold the phone and say, just start conversation back and forth. You talk sweet, you get more flies. So,
Yeah.
really.
So Alan, thank you, Ashley. Alan, do you see this? Is this a safe and secure way to visit the doctor? I mean, so many times people are wondering about their safety and security and technical difficulties. Do you just recommend this as a way to get those health needs met?
I've been doing this for almost 10 years. So, yes, depending on what platform you're utilizing, I know that when the pandemic hit, they released a lot of the HIPAA guidelines and restrictions on what telemed platforms you can use. But you wouldn't want to do it like on Twitter. You wouldn't want to see the doctor on a Twitter live feed or a Facebook live feed or anything along the lines of that. But just make sure that whatever your provider is offering, that that they have the HIPAA compliance, and that's crucial and important to make sure that you don't get hacked and that people get access to your information. Our platform is Visual, which I believe is the same platform that UAMS is using among several, but it's HIPAA compliant, it's secure, it's easy to use. Our providers simply just send a secure hyperlink to the patient. They click on it, enter their name, and they're looking at each other face to face. And no matter where, now you can't really control where the patient is located. Now we do try to educate our folks and say, make sure you're in a safe, secure place. We don't want you at McDonald's or Starbucks trying to do a telemed consult. Preferably you're in your home or in your vehicle. But the number of people that don't have connectivity is still pretty amazing for the state of Arkansas. So one of the things that we started doing was we started offering curbside care, where people could actually pull up to our clinic, connect to the Wi-Fi from our building, and then dial up and see their provider remotely from their vehicle. That was one of the things that we were offering. So, because just to help reduce some of that anxiety of having to interact with people face to face and get out and be exposed. But that's one of the things that we were still offering in some of our locations, where people can just pull up, connect, dial up, and say, hey, I'm here for my appointment, and then we just send them a link and they connect to their provider.
Okay. Do we have any questions? Zach, he's in the background. Do we have any questions? Okay. Is the patient able to continue their relationship with their current doctor through telemedicine?
Absolutely. If your provider has capabilities of doing telemedicine from their office, absolutely. There's no reason why you can't.
Okay. I'm trying to see if we have any more. Okay. Is there any special training or certification that physicians must complete to provide before giving telehealth, or can any physician start with providing this?
On the physician side, no. Their medical license pretty much covers everything. Same for the APRNs. However, for behavioral health, there are certifications that are required for behavioral health providers for LCSWs, LPCs, and so forth. They do have to have a telemed certification issued by their licensing board. If you're unsure and you're wanting to know, you can always check with your licensing agency to make sure. But those are the only ones that I'm aware of at the moment that are requiring special certification.
Okay. Let's see if there's any more coming up. I don't think there's any more questions at this point. I want to personally thank each of you, Alan, Laura, and Ashley, for giving your time to the caregivers in Austin, Arkansas to provide this information. Is there anything else before we end that you would like to chime in on, or?
Hey, my thing is that, and this has been my thing from the beginning. It's about helping people. I've been doing this for almost 10 years, and I get the biggest high when you get access to care for a patient that otherwise wouldn't have access. There's nothing quite like it. And in order to do that, we all have to work together. So if anyone ever needs any assistance or just wants to, bounce some ideas around, Ashley and I are always available. We talk to people all the time about, what can you do? What should you do? What shouldn't you do? So just anyone, if y'all ever have any questions or need any assistance or anything, we're always here to help, because, it's about caring for people and making sure they get the best possible care at, the most practical cost and the most efficient manner. So
thank you, Alan. So this program is sponsored, of course, by Alzheimer's Arkansas, AR Cares, and the Arkansas Geriatric Education Collaborative of UAM's Donald W. Reynolds Institute. The AGEC is funded by Health Resources and Services Administrative Grant. You can visit our website, www.alzark.org, to get any. I think I have another question. Hold on, I'm going to finish this and we'll see if we can answer. But you can visit any of our websites. You can, of course, go to Facebook and YouTube, and you can find all of the links to each one of our agencies. Just a reminder, Alzheimer's Arkansas is still providing resources to caregivers. We do have grant funds available. Our new grant year for 2020-2021 is about to start July the 1st. We have COVID grants to help with people's caregiver who has been affected, their employment has been affected, and we have family assisted program grants available. So we still have monies and grants available. Please contact us if you need any of that information. And I think my question disappeared. Will you mention again what types of services, the variety that AR Care offers through telemedicine? So that's from Leah.
You want me to take it, Alan, or you want to?
Sure.
Yeah, go ahead, Ash.
Okay. We do behavioral health. We do diabetes education. We do nutrition education. We take care of chronic care, acute care stuff, pharmacy education. Am I missing anything, Alan?
Intensive behavior therapy, infectious disease, correctional telemedicine, and what else?
I think that covers it. Infectious disease, that's including HIV clinics.
Mm-hmm. And we're doing, and we're also starting telereferrals. So that's one of the other areas that we're looking at expanding to in order to get our patients quicker access to care, because a lot of our clinics are in rural, remote areas. If you get a referral to a facility, you're looking at a day of work that you're going to have to miss. You're going to have to drive 1 to 3 hours in order to get there. And then, and then a lot of them are booked 3 months out in advance and, so forth. So in an effort to try and help reduce some of the no-shows with some of our partner facilities, that initial consult, which is typically just a face-to-face, or maybe a face-to-face with some labs, we're going to try to offer that over telemed, where they can just come to their home clinic meet their specialty provider, talk about what the best course of action is. If they need imaging or labs, we just take care of it right there in the clinic. And then their actual first in-person visit, they're not having to waste a day of work just for that. Hey, how you doing? You know, here's what I think we need to try, blah, 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 blah. So we're getting ready to launch that as well.
Okay, well, thank you for that. Again, I also want to remind everyone that we are here with for virtual lunch and learns every Thursday at noon. Next week we have John Ross. He is going to give us some legal advice and give us some general education on things we should know as we're aging and as we're taking care of our loved ones, some things that we should know legally to help that journey. So again, I want to thank everyone. Please please continue to keep up with us, share and like, and we will see you next week.
Thank you.
Thank you.
Bye, everyone.
Bye.
Bye-bye.